Hey guys, welcome to another video for anatomy and physiology. In this video, we're going to be looking at the posterior aspect of the leg, and we're looking at the superficial leg muscles in this one. Now, just to also mention, the lower leg muscles can be broken up into the anterior, lateral, and posterior compartments, and that's because the fascia compartmentalizes the muscles that way. And these muscles, the lower leg muscles, act on the foot. They either act as flexors, as the posterior muscles do, or as extensors of the leg muscle. Okay, so in this first video, we're going to be dealing with the superficial posterior leg muscles. So let's go ahead and dive in. And so here we have the posterior aspect of the leg, of the lower leg muscles. And so within this posterior group of muscles, this posterior compartment, we have superficial muscles, and then we have also more deep, profound muscles. We're just going to look at the three superficial muscles right now. And these muscles attach at the calcaneus. So let's kind of zoom in at the calcaneus. So if you remember your heel bone, right? We talked about it when we discussed bones. Let me see if I can center it. So here you see the bursa. Okay, the cushioning there. Okay, ooh, that's a little bit too much. So there's a calcaneus, and you can see the tendon here that's connected on the calcaneus. And this tendon, okay, is your Achilles tendon. Okay, that's what it's commonly known as. But the technical term for it is your gastrocnemius tendon. Okay, so the gastrocnemius, because it's connecting the gastrocnemius to the calcaneus, so the gastrocnemius tendon. So let's look at the gastrocnemius. This is the most superficial posterior muscle, and as you notice here, there's two bellies to the gastrocnemius. This is the calf muscle. You have the medial head, and then you have the lateral head of the gastrocnemius. And you'll notice that as we're kind of moving our way more proximally, you see that the muscle, the two bellies, are kind of going into, in between, or into the intercondylar fossa. Okay, if you remember that from the femur. So this is the intercondylar fossa, and then it's fitting right on top of the medial and the lateral condyles. So it's kind of like right up on the ridge of the femur, of the supracondylar ridges of the femur. Okay, so they're kind of inserting there, or their point of origin is there, sorry, and then they're inserting at the calcaneus. And so keep in mind that this is for these muscles that we're talking about, aid in plantar flexation. So if you kind of extend your foot out and then you point your toes, so you're pointing your toes. If you pay really close attention to the mechanics that's happening here, and you're paying attention to the gastrocnemius, the calf muscle, when you point your toes, you'll notice that the gastrocnemius tightens, it constricts, or it shortens, right? So as it shortens, it constricts. So imagine that muscle, and going back to the screen now, if you're imagining the gastrocnemius muscle contracting, so if it contracts, it's going to pull up on that gastrocnemius tendon, which is going to pull up on the calcaneus, which will then point your toes out, plantar flexation, right? So that's the gastrocnemius. And so what we're going to do here is we're going to cut the gastrocnemius out. So then we're taking a look at the soleus muscle here. And this is a deep muscle just below the gastrocnemius. And as you can see here, the soleus muscle is, its point of origin is at the fibula, okay? And also on the posterior side of the tibia, and then making its way also, like the gastrocnemius, on the calcaneus, or the gastrocnemius tendon, the Achilles tendon. Okay, this is actually also the strongest tendon in the body. So finally, the last the last posterior muscle that we're going to discuss, you can see it right here. This is your plantaris. Okay, this plantaris muscle again is attached on the supracondylar ridge of the femur, and it's making its way down into the calcaneus, just like the others as well. And this also aids in plantar flexation. Now, also an interesting note about this particular tendon that you're seeing here is that this tendon is usually the one that is used when they're making some kind of tendon graft on some other part of the body. They usually cut the leg open at that point and take a piece of that tendon out for some graft somewhere else. Okay, so I think that does it for the superficial muscles of the posterior aspect. And as I hide this muscle here, the soleus, you'll see that there's more muscles, and we'll talk about those in just a second.